What is the respiratory system? The respiratory system is how we do gas exchange between the blood and the environment around us. Any air coming into our body always has to do something with the respiratory system in some way by purifying the air, warming it, or humidifying the air. A major function of the respiratory system is to supply the body with oxygen and remove carbon dioxide. There are four parts of the respiratory system. The first one is pulmonary ventilation, which is just breathing. Second one is oxygen that diffuses from lungs to blood. The third is transports of respiratory gases. The fourth is internal respiration, O2 from blood from tissue cells, and carbon dioxide from tissue cells to blood. If there is a puncture in the pleural cavity, air can leak and will prevent breathing. Respiration is just the release of energy from breakdown of food molecules in presence of oxygen. Without oxygen, cells will lose ability for ATP. No ATP equals no new molecules, which is just basically any action. There are 6 important things about the respiratory system. The first one is the nose, which is the only seeable part, and the air enters through the nostrils, which just consist of nasal cavities divided by the nasal septum. The nasal cavity olfactory receptors are on the mucosa, and the rest is lined with the respiratory mucosa. It also moistens the air and traps incoming foreign particles, which is usually bacteria or some form. It also separates by the palate, which also has two parts: anterior hard palate, which is just bones, and the posterior soft palate, muscle. The second important thing is the pharynx, and the third is larynx. Pharynx is the muscular passage from the nasal cavity to the larynx. There's three regions of the pharynx, which is the nasopharynx is the superior region behind nasal cavity, oropharynx is the middle region behind mouth, and the laryngeal pharynx is the inferior region attached to the larynx. These two are common passageways for air and food. Larynx is the routes air and food into proper channels. It allows you to speak, or helps you to speak. It is made of hyaline cartilages, and larynx is structured with thyroid cartilage and the epiglottis, which is the superior opening of the larynx. This also routes food to the larynx and air to the pharynx. The next two is the trachea and the bronchi. The trachea connects larynx with the bronchi, and it also beats continuously in the opposite direction of incoming air and also expels mucus and other debris from lungs. The bronchi is formed by divisions of the trachea. It enters the lungs at the hilus. The right bronchus is wider, shorter, and straighter than the left. Bronchi also divides into smaller branches like a tree, then into bronchioles, and then into an alveoli. Each bronchus leads into the lungs. The next two are the lungs and bronchioles. The apex is near the clavicle for the lungs, and each lung is divided into lobes by fissures. By the left lung, 2 lobes, and the right lung, 3 lobes. Bronchioles are the smallest branches of the bronchi, and all small branches have reinforcing cartilage. Terminal bronchioles end in alveoli. The alveoli and the gas exchange. The alveoli is structured as the alveolar duct and the alveolar sac and the alveolus. Gas exchange takes place within the alveoli in the respiratory membrane. The gas exchange happens at the end of the bronchi, which is where alveoli is located. The gas exchange starts by the oxygen enters the blood, carbon dioxide enters alveoli, macrophages adds protection, the surfactant coats gas exposed surfaces. Stupid. The events of respiration and external respiration. Pulmonary ventilation is moving air in and out of the lungs. External respiration is the gas exchange between pulmonary blood and alveoli. Respiratory gas transport is the transport of oxygen and carbon dioxide via the bloodstream. Internal respiration is the gas exchange between blood and tissue cells and systemic capillaries. Oxygen movement into the blood, and oxygen movement moves by diffusion towards the area of lower concentration, and the pulmonary capillary blood gains oxygen. Stupid. Gas transport and internal respiration. Carbon dioxide transports in blood. A small amount is inside the red blood cells, but different sites than oxygen. Internal respiration is the exchange of gases between blood and body cells, which is the opposite reaction of what occurs in the lungs. Carbon dioxide diffuses out of the blood, and oxygen diffuses from the blood into tissue. At the bottom of the thorax, the diaphragm is there. When the air is inhaled, the diaphragm contracts and the rib cage rises, causing the chest cavity to expand, which is why our chest rises when we breathe in. Regulation of respirations is the neural centers that control rate and depth are located in the medulla. Normal respiratory rate is the 12 to 15 respirations per minute. Hyperpnea is increased respiratory rate, often due to extra oxygen needs. Factors that affect respiratory rate go from physical factors, increased body temperatures, exercise, talking, coughing, volition, and emotional factors. Respiratory movements and volumes. Non-respiratory air movements is just any reflex or actions that you can't control, which can be hiccups basically. Inspiratory reserve volumes, which is IRV, is the amount of air taken in forcibly over tidal volume. It's usually between 2,100 and 3,200 milliliters. Expiratory reserve volumes is ERV, and that's the amount of air that is forcibly exhaled, approximately 1,200 milliliters. Tidal volume is TV, is normal breathing moves about 500 milliliters of air with each breath. Residual volume is the air remaining in lung after expiration, about 1,200 milliliters. Vital capacity is the amount of exchangeable air, and the formula for the vital capacity is TV plus IRV plus ERV. Just add everything up. Dead space volume is the air remains in conducting zone and never reaches alveoli, which is about 150 milliliters. Functional volume is the air that reaches respiratory zone, about 350 milliliters. The chronic obstructive pulmonary disease is a major cause of death and disability in the United States. COPD includes patients that are always smoking, breathing becomes progressively more severe. Coughing and frequent pulmonary infections are also common, and after a while those infected will develop respiratory failure. This usually starts with air pollution or tobacco smoke. Bronchitis and asthma. Mucosa of the lower respiratory passages become severely inflamed. Pooled mucus impairs ventilation/gas exchange, which just means you can't breathe that well. Pneumonia is also common, and hypoxia and cyanosis occur early. Asthma is inflamed bronchial passages. It's the response to irritants with dyspnea, coughing, and wheezing.